I'm live. Hello, everyone. Hello, Rock Simmer. Hello, everyone. This is Dentist Live. I am back in my office today. I got some little water and I'm trying to do like a better lighting thing than I did, or Gal for God, I should call you both of them. How is everyone today? So I was planning initially to do a live earlier today, but I decided to do it still at my regular time. So just to let anybody know who's going to be watching. Hi, Izzy. Just to let anybody know who is watching. If at any point you want to ask any questions, just jump on and start asking questions. Usually it's a little slow to start. And then as we, hi, dear. Yay. Um, I'm in my whitening room today, and which I'm still in the process of designing. You can actually see the whitening light here, and you see royalty teeth whitening. But I just wanted to say hello to everybody. Thank you for tuning in. And for people who are new, just make sure you start asking questions right away. I'm Dr. Tamisha Denis, if you've never been on here before, and I just answer questions about dentistry. And if you don't ask questions, I just talk. I just talked. Today I'm wearing my pen shirt, and that's where I went to dental school, if anybody wants to know, University of Pennsylvania. But I do have some things on my mind that I'd like to talk about and kind of discuss today. Whenever I get questions and comments, I always try to answer them right away. But sometimes when I'm answering the questions and comments, I don't really feel like I'm saying it the way that I would if I were actually talking to somebody. And oh, Adir, you asked what time live was starting. Now I just saw that comment. So I have my little thing and I'm going to be going through. Hi, Mega Hips. Hi, Ashley. Ashley is a new name. Ashley, where are you from? Oh, look at me. I got lost. Oh. There was a really great question that I had earlier this week that I really wanted to answer, and I'm trying to find it. So please forgive me. In the meantime, if anybody wants to ask any questions, they can go ahead and do so. You know what? I'm going to start with this first question that I got earlier today. And it's interesting because every time I think of a video that I'd like to make, it's like someone comes and they ask me that same question. So someone was asking me about if you're high, oh, from North Carolina. You have been before. I have other people from North Carolina, I think, on here too, who always come on live. So a lot of times I get questions about um, TMJ. TMJ is a very, very popular concept and thing that we talk. I personally, I'm a clencher. I'm not a grinder. So just to say in general, there is the umbrella of the term is called bruxism, and bruxism just basically means that you're clenching or grinding your teeth. When I was in dental school, we used to make the joke and say that you're either a goat or a cow, and I might have said that in a previous video about TMJ, which I plan to do an updated version. But when you're a cow, that means you're grinding your teeth, and if you think about the way that cows' teeth look, they're kind of boxy and flat, and goats, that's what they say. Hi, Femi. Thank you. And then when you're a goat, it's more of like tip, 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 tip. I know that sounds weird. So I'm a clencher as opposed to a grinder. And I oftentimes have times either throughout my day where I feel that tightness in here, or sometimes I will feel just like when I wake up in the morning, when I go to brush my teeth in the morning, because a lot of times people ask me, how do I know if I'm clenching or grinding my teeth? And most of the time I'll say, well, when you wake up in the morning, do you feel tightness of your jaw? So let's say, for example, that first thing that you say in the day, like you're going to speak for the day and you feel like it really takes a good stretch to open your jaw. Or let's say, for example, you go to brush your teeth and it's really difficult to open your mouth. Then you kind of know that you're clenching or grinding your teeth. Now, someone asked me, which was I thought was a really great question, is are there exercises that you can do for your jaw to help relieve some of that pain and discomfort? And the answer is yes. I have never actually seen anyone do any sort of exercises for your jaw, but I have had a patient in the past who said that they were going to physical therapy. So forget the physical therapy. I'm going to give you a couple tips, and I'll probably make this video later on. But if you think about it, the TMJ, and I always like to use this as a reference, and forgive me, the lighting is not the best in here because I'm not at home, but here is your TMJ. TMJ means temporomandibular joint, and temporomandibular joint, say that 3 times fast, is right in here. It is a connection between your temporal muscles. That is a giant muscle that sits on the side of your head and attaches at something we call a condyle, which is your mandible, temporal mandibular joint. Okay, so that area of the connection that has cartilage in there. Imagine your knee has cartilage in your knee. There's also a cartilage in here. And if you ever hear anybody say their jaw clicks or pops, it's because that cartilage in there, if it's out of place, will slide past and make a noise and then come back and make that other noise. So sometimes it's either a slight dislocation or so much stress on your jaw from the clenching and grinding, and all that clenching and grinding, that is what causes the pain. Now, the actual popping is not pathological, meaning it is not going to hurt you, but the pain is really where it's at. So somebody comes to me and they say they're clenching or grinding their teeth and they're here clicking or popping. The clicking or popping, yes, we don't like it, but it's not something that's going to hurt you. Now, what's really going to hurt you mostly is going to be the pain of having it out. And if that joint gets pushed out of place and cannot go back, you may get stuck open or you may get stuck closed. So that's the hard part. That's the part that can cause pain. That's the part that is a little bit more detrimental. Now, going to talk about exercises that you can do for your jaw. If you can imagine, if you have pain in here, one of the exercises that I would recommend is just simply sticking your finger. I don't know if you stick your finger in here, and I would have to touch different people to see if different people feel it differently. But if you stick your finger, okay, so this is called your tragus, if you don't know what this little piece of your ear is, and that part right in front of it, there's a little indentation. And if you can find it on yourself and you open and close, as you open and close, you can, my jaw is a little deviated because I have TMJ. So when you open, you feel that joint. So one of the exercises I would recommend is kind of sticking it in there and there. When I push really hard, I have a little pain. So because I tend to clench and grind my teeth. So stick it in there and kind of move, open and close and massage it. Another thing that I like to do is, this is a little odd, but I like to go like this. And when I do that, I feel as if I am pushing those discs and back into place. One night I was eating something and I felt as if I dislocated my jaw. And as a dentist, that's quite scary. And I did that a couple times and I felt like I popped my jaw back in place. Now, those are only 2 exercises. I have a few ones for if you're in pain to kind of massage it, but it doesn't matter how many exercises you do. If you are a clencher or a grinder, the best way is prevention. You need a night guard. I am actually going to start selling my own night guards coming up soon because that's something that's so important. I would say in terms of the population, we probably have about 80% of people clenching or grinding their teeth in some way or another. So if you're clenching or grinding your teeth in some way or another, it's really important for you to have a night guard. If you have fillings, if you have crowns, if you have anything in your mouth, or even if you've had braces in the past, it is very important for you to protect your investment, because if you do not protect your investment, what will end up happening is you will break all of your work. You'll break your fillings, you'll break your crowns, you'll grind out your natural teeth. It is so important. I say what clenching and grinding does, it basically shortens the lifespan of your teeth. So if you could have had, like, every implant that I have is basically based off the clenching and grinding that I did that damaged those teeth and broke them. So that's my little word. I got my first question, so that I'm getting off my soapbox and I'll start talking today. Izzy says, when your teeth are removed, would you suggest getting bone graft no matter what age? It's not about the age. I would say it's about the location. So when you have a tooth removed, if you are not planning to get an implant, doesn't make a whole lot of sense to do bone graft. So for example, when you have your wisdom teeth removed, not about the age again, it's about the location. If you have your wisdom teeth removed, why on earth are you get bone graft? I'm going to say something, inside scoop, maybe save you some money. If you have a dentist who wants to bone graft a wisdom tooth, you should beware. I think that's very odd. And any dentist who's trying to bone graft your wisdom teeth is probably just trying to make an extra dollar out of you. Because there's no need to bone graft that. Now, if you're getting another tooth extracted and you bone graft, let it be for the plan that you're going to get the tooth replaced for an implant. If you're not going to get the tooth for an implant, if you're not going to get an implant, I don't know why you're bone grafting, because that bone graft is only going to last for a month or a couple years. And eventually your body's going to realize that you don't have a tooth there, and it's going to resorb the bone all over again. So if you're not going to get an implant, forget about it. Just save your money and don't even bother. Now, if you think you might get in the future, it is worth it for you to try, because I mean, it's worth it. Please forgive me. I'm going to drink water. Okay. Hope, Izzy, that answered your question. Hi, Elizabeth. I do remember you. Somebody else is from North Carolina. Ashley, meet Elizabeth. Okay. Pro Joe's Worthy. Hi, hello. Oh, I remember you from Poland. You went to the dentist for laser bio stimulation of the chin nerve. Is it because you had nerve damage? I'm very interested to find out what that is. Laser bio stimulation. I would like to know what that is. Let me know if you can give kind of feedback on that. T says, T Luing, I've seen this name before. Hi, Vancouver. Are we in a different time zone in Vancouver? I'm curious about that. One of my associates, she's from Montreal. She speaks fluent French. Yes. So is that what that's for? Laser biostimulation of the chin. You guys never cease to amaze me. There is so much dental technology out there right now. It's ridiculous. Like if I go to a dental meeting, I learn so many new things, and I feel like I'm always trying to learn what is new and coming out in dentistry, because things are ever changing. Thank God those things are becoming more and more easier for people to, it makes dentistry easier, and therefore it makes dentistry less painful for people in general. If there's anything in particular that anybody wants to talk about, I would love to talk about it. I was going to talk a little bit about whitening since I'm sitting in my whitening room. I wanted to talk a little bit about whitening simply because whitening is one of those things that I probably get a lot of questions about, but oh, I'm sorry. Before I start talking about whitening, I just wanted to respond. He says, I have a cyst remove and an apical ectomy, and it should help regenerate the nerve. That is awesome. I want to learn more about that. If anybody doesn't know, just talking briefly on that topic, one of the risks associated with having oral surgery is nerve damage. And last week in my live, I talked to answer a question to someone who has nerve damage after is somebody Queens and Kings, if I remember that correctly. But that person had nerve damage after wisdom teeth. And what happens is when you have a wisdom teeth removed, the number one risk associated with wisdom teeth removal is nerve damage. A lot of people don't know that because you really don't talk about it until you're about to have your wisdom teeth taken out. But if you can imagine, and I think I've talked about this before, we have a nerve. I guess this is the most popular part of our face today, right? We have a nerve that starts at our ear and ends somewhere around the middle of our chin. It is called the inferior alveolar nerve. The main branch of that nerve is called the facial nerve, and a sub branch of that nerve is called the mental nerve. Now, a lot of times when people have wisdom teeth removed, if that nerve is bumped or damaged, they will lose sensation in their chin. They will also lose sensation sometimes on the side, but the chin is the most common. Not as common is for you to lose sensation in your tongue, which is god awful because that'll make you talk funny and you won't be able to taste your food very well. So can you imagine? That's a huge risk. And I tell people all the time, if I think that that's a possibility, I'd rather not take out your tooth unless it is worth it. Now, if you're, I feel like putting a public service announcement. I said this last week. If you are under the age of 25 and you have wisdom teeth, think about taking them out because excuse me, that was in the water. Because for God's sake, if you have wisdom teeth and you haven't taken them out, you are going to raise the level of the chance of you possibly having some sort of bad result in the future. I take out wisdom teeth on 65-year-old. Now, if you have wisdom teeth that are straight, wonderful. You have wisdom teeth that are straight. You still can have problems later. You can still have problems later. And the reason that you can have problems later is because hygienically, it is a very difficult place to clean. So good luck. I can't say your name, but good luck. I hope you get all your sensations back, and I'm going to look into that too. Ashley says, somewhat off topic, however, your video on the tooth numbering helped me prep for dental assisting school. Yay! I love that video. Oh, I'm going to have a visitor real quick. Do you need me? Oh, I'm on the other side. Okay. Tooth numbering is really awesome. The next video that I'm going to make about that, I thought I made, you know what? That's been a while. So maybe I haven't made that video about tooth surfaces too. I think that's a really great one too. I don't know, Ashley, if you watched that, but tooth surfaces, that's a really good one. That's very important. I have been recently interviewing dental assistants, and it's surprising to me the way that I do dentistry. I do dentistry with full intention to not only have a dental assistant that is competent, but also a dental assistant that understands why on earth they're doing what they're doing. And a lot of people who are in dental, come out of dental assisting school and stuff like that, they don't really understand the purpose of what they're doing and why they're doing it. And if you don't understand the purpose of what you're doing and why you're doing it, you're going to fall in every kind of pitfall, and you're not going to really understand what the dentist is doing from the dental assisting perspective. So can you imagine from the patient perspective, I have seen people who have had multiple root canals and they don't even know what a root canal is. They have a crown. They're like, Dr. Dennis, what exactly is a crown? What exactly is a root canal? And that just goes to show that the dentist is not educating the patient. I tell patients, especially when it comes to gum disease, you need to understand why on earth I'm telling you what I'm telling you to do. Because if you don't understand why I'm telling you what to do, you move to another city, you go somewhere else. You don't know why it's important to keep up with this. You just think you're just doing it just to do it because my dentist said so. But you need to understand for yourself, your health is your priority. If I never know you again, you still need to know what's good for you, right? Eloise, that's a new name. Hi, Eloise. What can be done about a gummy smile? Oh, I love this question. My teeth look tiny because they're covered with my gum. What can I do? I have, and listen, I'm not like texting. I would never do that. But I'm trying to see if I have a picture of one of my patients that actually probably a few months ago, she had the same issue. She had a very gummy smile. She felt like her teeth were very short. And because she felt like her teeth were very short, we did something called a gingivectomy. And a gingivectomy is basically going to remove the excess gum tissue above your teeth cosmetically. There's other reasons we do gingivectomy. I found the photo, by the way. And it actually makes your teeth look better. And the reason that a bigger tooth looks better is just simply because bigger teeth actually look younger. I don't know if anybody knows this. I said this to one of my patients that I was doing a whole bunch of crowns on this weekend. Not this weekend, last week. And I was like, do you know that bigger teeth look younger? People with short teeth, bringing me back full circle to what I talked about at the beginning about clenching and grinding. Over time, clenching and grinding makes your teeth look short. Short teeth make you look old. Short teeth make you look old. Okay. So let me show you this photo. I don't know how well it's going to show. Whee! Oh, this is horrible. Okay, that's a little better. So the top photo, this is a patient who had a lot of gums covering up her tooth. Okay, sorry, everybody. This is a patient who had a lot of gums covering up her teeth, and she didn't like the way it looked, or maybe if I play with the different angles. So we went across the top, and trying to see if it changed angles. We went across the top and then we took some of that excess tissue. She actually came back twice. Sorry, I keep playing to see what's going to do the best. She actually came back twice because the first time I do a gingivectomy, what I typically do is I take a little bit less than I normally would because I want to make sure that I'm not taking too much and that you like what you see. After I did that, it kind of relaxed and she was like, ooh, I like it. And she came back and we trimmed some more. I can't remember if this was my first before and after, but she did come back and we did some more. I wish I could post a picture. You know what? Maybe I'll post this picture because I was really happy with the result. And so was she on what it looked like. But I'll post a picture just to show you guys what a gingivectomy. I hope that helped your answer, but it definitely can be done. It is not harmful. It takes a little anesthesia, and that little anesthesia really local, like little dots here. And then also the recovery is super easy. The recovery is like nobody is, I would say is as bad as a, what do you call it? A pizza or something like that. I'm sorry. I think I have the hiccups. I apologize, everybody. um, so, and we give a little, now when gums heal, typically gums will turn white first, then they will turn red and they'll turn back to their pink color. Okay. All right. Ashley, I don't. Oh, yay, Ashley. She watched my other video. Mega Hip says, if you're getting all your teeth extracted, do you still need deep scaling? It depends. It depends. There are times. Okay, so for me, when I'm pulling a lot of someone's teeth, like recently, I'm going to be starting an all-on-6 case on a patient that we're going to take all her top teeth and all her bottom teeth. But I did have her do several cleanings, including maybe a deep cleaning we might do, simply because the bacterial level in your mouth is very high. And sometimes reducing the bacterial level, depending if you're not pulling all the teeth out at the same time, will help you kind of go slower and choose which of the teeth you're going to do at the same time. So let's say, for example, Mega Hips, you're doing the upper only, but you're not doing the lower. It may behoove you to do a deep cleaning or just a cleaning on the bottom, so that when they do the work on the top, that bacteria is not traveling to the top to infect that. You do plaque. Calculus plaque is basically bacteria that's deposited all of these calcium deposits on your teeth, and bacteria lives and thrives on that. If you know what a cavity is, a cavity basically is a bacteria that's in your mouth, is eating what we eat and deposits acid onto our teeth. So imagine the bacteria that formulated that calculus is still in your mouth, and it is more healthy for you to get it out. Now, if you're taking all your teeth out at the same time, I'm not really sure why they need to do a deep cleaning, but if you're doing several at a time, I see the benefits of that for sure. I hope that helped. I will definitely post it on Instagram too. I can do that. Oh, you know what? I might have already done that. Eloise says, can you have it moved? Can you have it moved if you are a bleeder? Can you do a gingivectomy if you're a bleeder? Hold on. Are you the same one who asked about? Yes. If you're a bleeder, it doesn't matter. Gingivectomy, if you're talking about gingivectomy is so minimally invasive. What we use is something called gosh, I just lost the word as I was talking. Twitter, I don't tweet. I don't know if you guys know this, but I'm older than everybody thinks. So I'm not so computer savvy. Sometimes I'm like, I don't tweet at all. I should get a tweet. You know what? Maybe I'll look into that because I'm trying to boost my social media game up. We use electrosurge. Sorry, the word left me. It's because I'm thinking as I'm reading at the same time. We use electrosurge, and electrosurge is basically a cauterizing machine that burns as it cuts, or just burn or just cut. But you have the burn and cut. So as we go around the gum line, now if you touch your tooth, it'll give you a little jolt, which is not nice, but I'm very gentle, and I have different shaped tips that go across, and I'm basically making the little U's across here, but it doesn't cause bleeding. Actually is the opposite, because it cauterizes. When we laugh, does it emit plaque? Oh my God, I've never heard this question before. When we laugh, does it emit? I don't think so. However, we're always sharing our germs with other people. So it may not be emitting plaque, but you are sharing your bacteria, which becomes very important. And I think I mentioned this on my cold sore video, but when you have a child and you kiss them, if you have cold sores, you can give them the virus that causes the herpes simplex virus that causes cold sores. Everybody hates the words herpes. They think of genital herpes and all kinds of other things, but there are different kinds of herpes with different, I forget how many different kinds of herpes exist, but herpes simplex is the one that people get fever, blisters, and cold sores. I myself get one maybe once every 2 years, to be honest with you. Ever since I made that video about vanilla ice, ever since I made that video, I just thought of that right now. I swear to God, I never even thought about saying vanilla ice until then. If I would have remembered that, I probably would have put some ice baby things in that video, because I just realized that's so cool. So anytime I even feel the tingling sensation of a possible cold sore, I literally put my vanilla on. I have one sitting. I got so much flack about me putting my Q-tip into my vanilla. I don't know why, because I don't use that vanilla to cook. It's in my bathroom and it sits there. If I even think I'm getting get a cold sore, I'm already putting vanilla on my lip. And I've actually recently heard that vanilla is good for toothaches. That is something that someone who's much older than me said, that vanilla is good for toothaches. Now, I don't believe in too many remedies for toothaches that are over the counter, because I think you should just go get your stuff fixed. But vanilla is good for toothaches. So is cloves, if anybody wants to know that too. Little tips. I feel like I'm giving little nuggets today. So what I was going to say about my cold sore, and when I was in Tennessee, if anybody watched the live that I had with my sister, who's a dentist, but I started to feel the tingling sensation on my lip, and I was like, oh, shoot, I'm going to get a cold sore. But this time, because I wasn't at home, I didn't have my vanilla, and I just did some mind over matter. I said, no, not today. I do not want a cold sore. And guess what? I literally felt the tingling on my lip, because I usually get them right here, and it never developed. So I don't know, maybe my immune system is getting much stronger. But, for my channel and just for in general what I do, I really base a lot of everything that I do, not in textbook. I base it on me, because I know what it feels like to have dental work done. And I also base it on the questions that people ask me every day. I see a lot of people, and people ask me every day, Eloise, your hemophilia, I don't think you'll have a problem. Definitely discuss that with your dentist before you do it. But remember, if they're cauterizing and burning, and we're not going into any major blood vessels, you're going into tiny. I do this procedure and implants and extractions and all of that. I do on people who use blood thinners, who are warfarin and all of that other blood thinner kind of stuff. I do extractions. I do implants on them. Sometimes they stop their blood pressure medication, not their blood pressure. I'm sorry. Their anticoagulants. I'm trying not to say fancy words or words, blood thinner medication. And sometimes they don't, and they're fine. They're fine. Just a quick tip. If you ever have that problem, you can always bite on a tea bag. I don't know if anybody's ever heard that. Stop your bleeding. There's tannic acid in tea bags. And if you ever have an extraction, if you have a hard time stop bleeding, I don't know if it works on the body, but it works in the mouth. You can get a tea bag, wet it up and bite on it, and it'll stop the bleeding. Izzy says, how long do you think dentures will last before bone loss? Oh, the rate of bone loss is different for everyone. The rate of, thank you, John. The rate of bone loss is different for, I'm overdue on a denture video. Like I have so much to say about dentures, and I'm overdue on a denture video. But the problem really is, side note, the problem really is I have so much to say about so many things. If I had the time to do it, I'd make more videos, but I don't have the time to do it. That's just the simple thing. But I know, right, Adir? It is a good question. So it's the rate of bone loss is different for everyone. I think last week or the week before, when I was showing all my models, I showed a model of when you have teeth, when you lose your teeth, how your jaw shrinks over time. I have literally met people who have had missing teeth for a long time, and they have just as much bone. And I've met people that they've only been missing their teeth for a year or two, and they look like a witch. Like, that witch's chin that's really, really thin and small, and their mouth is collapsed. I mean, it takes time for that to happen, but for the most part, if you lose your teeth, you are going to lose bone, but the rate at which you lose it is so different. For example, a single tooth is the same amount of rate of bone loss as all of your teeth, right? So let's say, for example, you lose a tooth, a molar. The sinus is going to start to drop into the empty space, which is going to reduce your bone. It's going to start to shrink widthwise, horizontally and vertically. It's going to shrink this way and shrink this way. So you have all these shrinkage happening. Now, of course, and I don't have any studies in front of me, there are studies and the rate at which they follow people losing bone, but it's so different. If I tell you, oh, you're going to lose bone in 6 months, that's a lie. There's no way for me to know that. And really, you can see, it also depends on the denture you're wearing. If it's banging and putting a lot of pressure on your jaw, and you're getting like you're hitting it a lot too. So I don't know the answer to that question. If the reason that you're worried about bone loss is to be able to retain your denture, then that's one thing. If the reason you're worried about bone loss is to get implants, that's another thing. Because if you're going to get implants, you should try to get them sooner than later, because you will lose bone eventually. How long did I go to school? Does everybody mind me drinking some water? Well, I don't really care if you mind, because I have to drink some water. I'm just talking so much. Okay. I'm going to answer John Brown's question. How long did I go to dental school to become a dentist? I went to dental school. I went to Penn. I went to dental school for 4 years. I went to undergrad for 4 years. I have a bachelor's degree in biology. And then I went to dental school for 4 years. After that, and I think I said this before, I don't know, maybe I'm repeating myself for the newbies. Once upon a time, I thought I wanted to be an oral surgeon. If I wanted to be an oral surgeon, I would have to go to dental school for 4 additional years after dental school. And if I wanted to be orthodontist, maybe 2, sometimes 3. If I wanted to be a periodontist, 2 years. That's a gum specialist. If I wanted to be a prosthodontist, that's another 2 years. So there's different specialties. Endodontics, that's another 2 years. That's a root canal specialist. So depending on what specialty in dentistry you want to do. Now, the great thing about being a general dentist is you can do whatever you want. I can do braces. I do extractions. I do implants. I do gum surgeries, minor gum surgeries. I don't fix people's jaw like oral surgeons. Like oral surgeons, if you broke your face, like literally if your zygomatic arch, which is your cheekbone, if that broke, they'd fix it. Your orbital bone, they fix that stuff too. So they do a lot of different things. Adir says, what's the worst case? Oh, did I miss somebody? What is the worst case you have ever encountered when it becomes, oh my Lord, you guys make me want to, oh, okay. I'll tell this story really quick, right? So one time, oh, I just saw this is so cute. I didn't even see that this is, it's a double on double. I had a patient, I don't know if I ever told this story. I had a patient that it was a Sunday. It was a Sunday. I was at home, and we used to be open 7 days a week in our office. Now we're open 6 days a week. We used to open on Sundays and just do cleanings. I wasn't in the office, but my front desk girl, she called me and she said, Dr. Denis, you need to come right away. This kid's teeth are outside of their face. And to be honest with you, if I wanted to, the only way I could truly describe to you what I saw at that point was something that you cannot imagine. So I didn't get the story, but when I'll tell you the story in a second. But when I came into the office, I literally had just come from the gym. I was wearing a hoodie, a baseball cap, and leggings and everything, and my sneakers and everything. And I came to the office because she was like, you need to see this kid right now. And I was like, what happened? And literally his 2 front teeth were outside of his mouth, and he had braces. How do I describe this? He had braces like this, and his 2 front teeth and the root were sticking outside of his mouth. They were not even in the braces. They were not even in his mouth. The only reason that they were anywhere in his mouth was because the brackets were still hanging on. And the reason that happened, and if I find that picture, I will definitely share it. The reason that happened, he was doing a sleepover, and at the sleepover, a kid was getting mad at him, and the kid had a racket, and he turned around. This is the story that the mom told me. He turned around, and when he turned around, the kid had a racket and swung at him with the racket. And when he turned around, it grabbed the brackets and pulled his 2 front teeth out of his mouth. His mom didn't know what to do because it was a Saturday night that happened. They went to bed with his 2 front teeth hanging out of his mouth. And basically the teeth, it's like the worst thing you're supposed to do when your teeth, oh, another video idea. What do you do if your teeth get knocked out? So what happens is at that point, the mom freaks out, starts making phone calls on Sunday morning, but who on earth is going to be open on Sunday? And we were. So as soon as I saw him, I didn't ask about anything. I didn't even care about the story. And then I had him come straight to my operatory. And I said, look, I know this is going to hurt, but this is what we have to do. And I bent the teeth back and shoved them back into the socket. Now, just really quickly, I know I have other questions to answer, but this is really important. If you have children, anything like that, make sure they wear a night guard. I mean, wear a sports guard when they play sports. But because I've had other football stories, recess stories where parents come in with their with the tooth in their mouth. And the first thing you should do is shove it back in the mouth. That's the safest place for it to be. A child can regenerate a tooth. It's very difficult for an adult to regenerate a tooth. That means for a tooth to become a part of the mouth. Now, if that happens, and if you can't put it back in because you don't know what to do, you take the child's saliva or your own saliva and you put it in a cup and go to the dentist ASAP, like ASAP. I did a thing about brown front tooth. Your tooth still may die, but at least you have a chance to recover the tooth. I have so much more to say on that. I just got to stop. Mega Hip says, if you're getting, so I hope that wasn't, listen, if I showed the picture, it would be a lot more dramatic than I hope I did it justice. Anyways, Mega Hip says, if you're getting dentures, it's normal to have alveoloplasty and bone graft done. If you're not getting implants, alveoloplasty, yes, bone graft, maybe. Alveoloplasty just means that we're going to shape the bone. Excuse me. We're going to shape the bone so that we don't have the lumps and bumps. So when the denture seats, it seats smoothly. So a lot of times if you have like spiky parts of your bone, because remember when you're taking your teeth out, the bone is not smooth until after it heals. So if you're going to make a denture and you have those sharp parts sticking out, what's going to happen is that those are going to become sore spots for you later. So sometimes the dentist likes to take the teeth out, shave the bone down of all the lumps and bumps that you normally wouldn't have noticed when you had teeth, but you will notice when you don't, so that you can make it smooth and then they stitch you back together. Bone graft is not necessary if you're not having implants, because either way your bone is going to shrink, but there may be some justifications to do bone graft simply because you want to make sure that you keep as much bone as possible for as long as possible. So there is some benefits for that. I'm not telling my age, but I am not the young. Oh, I have an associate who's younger than me. Okay, you guys can do the calculations yourself. When I became a dentist, I was 26 years old, straight out of dental school. I used to lie about my age because everybody thought I was the hygienist, and they would be like, are you the dentist? And even now, sometimes I come into the operatory and people are like, are you the dentist? I'm like, yeah, it's me. Thankfully, I've been practicing long enough that now people know who they're coming to see when they come to see me. If a family member referred, they say, oh, this is my dentist. She looks young and stuff like that, but she's not as young as she looks. But usually once I start talking, they figure out I know what I'm talking about. And that's what it is. Can somehow bone after extraction get higher level without augmentation, like from a massage maybe? I am not within the scope. I will never say anything is baloney. Never. I don't believe in that, because I do believe, I just told you the story about how I was feeling like I was getting a cold sore, and I mind over matter, I made it go away. So unlikely that your bone will gain in height, but maybe you can reduce the shrinkage of your bone by healthy practices. So not necessarily you're going to make it grow, but what if it doesn't shrink? That would be awesome too. If you find out if there's any massages or any bone stimulation that exists, I would love to know, especially because you were talking about that stimulation thing. Adir is a good question to ask her, Elizabeth. Do you offer snap-in dentures at your office and over-dentures in the same as snap-in dentures? Yes, I offer snap-in dentures. Not a huge fan, but I like them. Okay, so let's think about dentures in this way. We got three options. We have a traditional denture. You have nothing in your mouth. It's just a denture sitting on your bone, and you're gone. Then you have a snap-in denture, or we call it an implant retained denture. That's in the middle. You have the implants in your bone, and you snap the dentures into place. Remember, I think I talked about this last week. If you have an implant retained denture, then you don't have to have the palate of the roof of your mouth covered, which is freaking awesome, because then you can taste your food and speak better. And then you have the last option, which is to have a full all implants, right? So if I had to choose, full implants, I think is the best. Everybody's going to say, oh, it's because it makes you more money. No, that's not why. I never do that procedure for somebody and somebody's not happy. Everybody that I've ever done all on 6-on, they're elated. They don't want to have dentures and they don't want to have snap-in dentures. So they're elated. I know everybody wants to relate it to money. The reason it costs so much money, because it takes so much time. It takes a lot of my chair time. And I am very caring and I take my time. So I take my time. In the middle, that snap-in denture, the reason I like it, but I don't, it is way better than a denture, but not as good as having full implants. But it's a wonderful option. It's a wonderful option. It changes people's lives. People have been wearing traditional dentures for years and move into a snap-in denture. They are very, very, very happy. and it keeps your bone. When you do something like that, your bone actually doesn't shrink. An implant, we've been talking about a lot about bone shrinkage and stuff like that. An implant keeps your bone because the body thinks that you still have a tooth there. So Jesus is raised. Wow. Why are we saying wow? I'm just going to say wow with you. Adir says, thank you very much. Yay. I did not accept to the story. Have I ever fixed my own teeth? The answer is yes, but I'm not very good at it. One time, if anybody is from the islands, they'll know what sugarcane is. And people from the islands, we like to eat sugarcane and we like to eat it like that. And I went to go visit my mom in Miami and I was eating sugarcane and I cracked my tooth in half. One of the teeth that right now I have an implant for, and it didn't hurt or anything because I had a root canal on it. And that's why you should always get a crown on any tooth that has a root canal. But I made a rookie mistake and I hadn't gotten around to it because it is harder for me to get dental work than other people because I have to get somebody else to do it. But it cracked in half and I proceeded to go to my office to try to drill on myself. Drilling on myself to try to smooth the rough edges literally left me drenched. I tried to enlist my husband to help me and he was not about that life. He was like, what are you doing? Please stop. I have given myself injections. I actually recently, like a month or two ago, gave myself an injection because I wanted to numb myself where I needed to uncover my implant. Oh, I don't mind giving myself an injection at all. I'll give myself an injection on tape if anybody ever asks me one day. I will. I can't give myself a block because it's too far to see, but I've given myself injections and it doesn't hurt. And I don't use topical. Is it possible to get rid of gingivitis? Absolutely. Gingivitis is reversible. Gingivitis is reversible. Gum disease is not reversible. Gingivitis is reversible. Gingivitis means, sorry, I always hear noises when I'm alone here. Gingivitis is basically the inflammation of your gums. Gingivitis, itis means inflammation. Now, if you have gingivitis and you go to your dentist and you have a cleaning and you floss your teeth and you brush your teeth, you will get rid of the gingivitis. Now, when gingivitis goes untreated and you have plaque, I know Adir was asking about plaque being transmutable. If you have plaque that goes unremoved and that plaque irritates your gums and your bones, it will irritate your gum into the bone to the point that you get bone loss. Once you get bone loss, most likely, even though we talked about mind over matter, if you get bone loss, most likely you will not regain your bone. You can stop it from further happening by getting deep cleanings, by having by good maintenance at home and having good practices, but you will not eliminate your gum disease, but you can control it. So it will not go away. I will still see on your x-rays that you have lost bone in the past, but you may not have inflammation, you may not have bleeding, you may not have pus. I think I got already 10 good video ideas that I need to talk about ad nauseum, and gum disease is one of them. So my goal usually for people with gum disease is to get a deep cleaning, and we do something called periodontal maintenance, which means we want to maintain you so the plaque doesn't build up and continue to destroy your bone. So it is reversible. And I was talking recently about oil pulling again because I plan to do another oil pulling video simply because oil pulling is a great way to help, one of those adjunctive things that you can do at home to help control gum disease, which I really, really like. Thank you, John. That is very sweet of you. I should do a video about how I take care of my own teeth up close. I will not lie. I'm recently embarrassed about my own teeth. That is my confession right now. I am recently embarrassed about my own teeth. And that is because I have three implants right now in my mouth, 2 on the left and 1 on my right that do not have crowns on them. I actually was wearing a temporary crown yesterday and it fell out and I had to take it out, and I'm on the process of making. So even my TMJ video, I didn't want to do because if I open my mouth really big, I see that missing. And then when I smile like this, oh, look, you see the little empty space. And that makes me crazy. And that makes me so embarrassed because I'm supposed to be a good example. But I told you before, the hardest thing for me is to get somebody to do my dental work, and I do my own dental work. That's like no problem, but it's not the problem. The problem is for me to sit still. If you can see, I'm super antsy. This is how I am all the time. And when I'm in the office, I'm trying to get stuff done for my patients. I'm not really thinking about myself at all. So it's like to get myself to sit still, that is where it's at. I need to sit still and I would get it done. Eloise says, what do you suggest a person with foul breath odor that have Trimethyl. I don't know what that is, but I may have to look it up and multitask. I have a lot of tips about breath in general. I actually have another. I recently found this thing. I was going to do a video on it, but I just haven't gotten around to it. It's called internal deodorant. An internal deodorant from, I got it from Whole Foods, and it's a green mouthwash. Oh my gosh, it's delicious. It's delicious. I got it from Whole Foods. I'm pretty sure you could get it on Amazon because Amazon bought Whole Foods. But yeah, it's like um who asked the TM? Eloise, give me some time because I'm reading about TMAU, also known. I am very interested to read more about that, and I don't want to give you a thing. But in general, bad breath, the best thing that you can do about bad breath is really for scraping your tongue, making sure you don't have digestive issues, and making sure you don't have gum disease. The number one cause that I find about bad breath is gum disease. That plaque that we've been talking about the whole live session holds smell. It holds everything. Imagine it like a stinky sponge in your mouth that's holding all the bad stuff that you want to get rid of. Abscesses also cause bad breath too. So you have to make sure that your mouth has no dental issues before you start diagnosing yourself with other things. And I find that a lot, that people come in and they say, oh, I have a ear infection. No, you don't have an ear infection. You have a toothache. Because remember that same nerve, man, this is the thing of the day, right? That same nerve that starts here, that can make you feel like you have a earache. You don't have an earache. You have a toothache. And there's something also called trigeminal neuralgia, which people have often thought they had some neurological disease and they just have a toothache. Izzy says, how many teeth can you put on an implant placed bridge? Ooh, that is a great question. Typically, there are rules. Well, rules. I follow someone, his name is Dr. Mish. He basically wrote the book on implants for dentists. And Dr. Mish, oh, rest his soul, he actually died last year. But he doesn't recommend having more than 2 pontics. That means pontics are, so you have an implant, and in between, in the middle of the bridge, you have the teeth that don't really have teeth but look like it. So he doesn't recommend more than 2 pontics in general, because once you go to 3, now you have this long span bridge that in the middle can collapse, and you don't want that, right? So you want enough. So like if you had a retainer, or we call it a abutment tooth, then we have pontic, then retainer. You could go again, pontic, retainer. I mean, we can do a few more in the front. I can do up to 4 sometimes in the front, depending on the circumstance. Oh, I did a really beautiful case like that. If I find it on my phone, it's just a day for me to look at my phone and find pictures. I try to take before and after pictures on my patients. I don't always remember, but you can have more than 2. If I found this one, it would be great. I will find it. The next question. Oh, Mitham, hi, how are you? INR that is suitable for tooth extraction. What is INR? INR. Am I forgetting something what INR is? Please tell me what I feel like you're saying something about a nerve. So please, Mitham, can you say that again at the bottom and tell me what the abbreviation? Maybe I'm just having a brain moment. Hi, Bree. You just had some fillings done. Did it go well? Let us know. His smile teeth. Oh my gosh, you guys are giving me things to Adir, you know, you're one of my favorite subscribers. I will get back to you on that. I don't know what his high smile teeth, not his. High smile teeth. I'm gonna look that up. I have 2 things to look up now. I have to look at that INR. I have to look at that and that. Oh, don't be embarrassed. Listen, I am not one of those people. Do you know those personal trainers that are overweight? Like, if you're a personal trainer, I figure you should be fit. If you are a dentist, you should have nice teeth, right? In dental school, I love to tell this story. I had a professor. He was our endodontics professor, the one that does root canals, and all his bottom teeth were black. I'm not lying, black. I'm like black, like the screen black. That's how black his teeth were. And whenever I used to talk to him, I used to just look at his teeth. I can hardly concentrate on what he was saying. Kings and queens, I literally was just talking about you, kings and queens, and we were talking about nerve damage and how nerve damage and wisdom teeth. John Brown, if you ever met me, I recently met one of my subscribers who actually is going to be working for me now. Her name is Kathia. She will be in our office soon. And I tell everybody, the way you see me now is the way I am all the time. I met one of my Instagram followers, and she was like, oh my God, I'm meeting you, Dr. Denis. I was like, oh, I'm the same person. I don't have two versions of myself. I don't have two versions of myself. I have relaxed and more relaxed. And right now, when I do live, I'm more relaxed. That's why you see my jeans and stuff like that. Yes, everybody call me unprofessional if you think that's unprofessional. I love it when people love to comment that it makes me unprofessional because I don't look like a dentist. I just don't look like a dentist. I just don't. I'm over that. I'm too old to care about that anymore. Mega Hip says, can having bad teeth cause other health problems? Absolutely. Yes, 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 they can. Yes, they can. Man, that was 50 minutes. I just looked at the time and I can't believe it's 50 minutes. So yes, because the bacteria in your mouth, I just love the fact that this live has a theme today. I never know what we're going to talk about when we start talking about it, but it does. If you have bacteria in your mouth from an abscess, okay, I posted on Facebook an article of this guy who died because he had an abscess and he got sepsis. Sepsis is a systemic bacterial infection. He basically ignored a toothache for a really long time and the thing got out of control. Gosh, I want to make a whole video about this because the bacteria in your mouth can travel to your heart, and that can actually, I'm sorry, he didn't get sepsis, he got bacterial endocarditis. But bacterial endocarditis, for anyone who's ever had a artificial heart valve, has a heart murmur, has artificial joint or hips, your doctor will always tell you before you go to your dental appointment, make sure that you take antibiotics, because what we are trying to prevent is when we do your cleaning, we release the bacteria into your system and it travels throughout your body. And there are whole diagrams for all the things, even to premature birth, that periodontal disease, mostly because periodontal disease, gum disease, is what's holding the most of the bacteria, even though decayed teeth can do it too. For the most part, it's gum disease, because all that bacteria that can travel to your heart, and it can cause bacterial endocarditis, which is fatal. It can cause abscesses can swell in your mouth and close your airway, and you cannot breathe. It can travel up through your sinus to your brain. I don't say any of that to be scary. These are not things that happen commonly. Oh my gosh. These are not things that happen often. They're not things that happen often, but they happen to a serious enough effect that you don't want to play around. If you have an abscess, get rid of it. If I said you have a filling, you need to take care of your filling, sure, take care of it. I'm not belittling the filling. But if you have an abscess, you have a fistula, and I'm due to make an abscess video. I've seen some nasty ones, some really nasty ones. Get it taken care of. It's not worth your life. Get the tooth pulled. If you can't afford the root canal or something, get the tooth pulled. You know, dentistry, my dental professor at Penn, not my dental, the head of the school at Penn, the dean at Penn, used to say, after all, it's just teeth, right? So even though teeth are very important, that's my livelihood. That's how I make my living, is with teeth. In the end, it's just a tooth. It's not worth your life. It's not worth you going into crazy amount of debt and stuff like that. Do what is reasonable, but take care of yourself. Take care of yourself. If I have to preach anything, I always preach self-care. I had a similar situation multiple times, enlarged one tonsil, and it was weird. And later on, I connected with the cyst under the tooth. Ha ha ha. Izzy says, yuck. Most of my things are yucky. I see things all the time that smell bad. I have a lot of energy. I am like this all of the time. If you see me walk through my office, one day I wanted to do a video. If it wasn't going to mess up my HIPAA compliance, I was just going to put my camera at the end of the hall, and you can watch me run back and forth, run back and forth. And I actually run sometimes. I should be one of those dentists with the skates. You know, those dentists that are those people who have skates. Oh no, then I would end up like that guy with the hoverboard. After all, I did see that hoverboard. I think Adir is the one who mentioned the hoverboard. I don't know who mentioned the hoverboard thing to me a couple weeks ago. And I saw it and I thought it was dumb. And that was done. Oh, international. Oh, because. Oh, I need to look at. Oh, now I forgot the question about INR. Yes, INR. What is wrong with me? Yes, I'm still on live. We're wrap it up soon. I'm going to have to wrap it up, but I'm going to answer that question very soon. And Bree says they didn't numb the teeth. So you had, oh no, your gums were hurting. So that means you weren't numb enough. John Brown says, I will definitely do that. Oh, John, how are you thinking about becoming a dentist? Let us know how that goes. I love that. I agree with you. Well, I mean, the face of dentistry is changing because the older ones are dying out and there's a lot of younger ones. But it's true. And the face, I used to live in Georgia. I used to live in Duluth, Georgia, if you know where that is. But anyways, the face of dentistry is changing, and it's nice to have a variety of people that look differently, because in the end, everybody wants to be comfortable. You want to have somebody who's competent, who can take care of you, who knows what they're talking about, who is compassionate. All of those things are so, so important. This is what I'm going to do for the answers, the questions that I did not answer today, because I have to go. Like I always like to say, I got kids, so I have to take care of them. But I do want to say I have a pretty good memory if anybody has not noticed already. I already know the questions that I need to answer. And if you guys can do me a favor, if I did not answer your question, if you're tech savvy, can you copy and paste it onto this video? Don't forget to give me a thumbs up. It's nice. It puts my videos higher up on, I don't know, whatever YouTube does with their algorithm and stuff like that. But I always enjoy these times so, so, so much. I love the participation. But please, please, please comment below if I didn't have a chance to answer your question, or I didn't answer your question to the extent that you wanted me to. I will either answer it in some really ridiculously long comment, or I will make sure to make either a long form video about it. So be patient with that. But I will also make sure to answer you directly. Like I will make sure your question will be answered. I'm like very happy with my hands today. So I enjoy it. I always like to shout out everybody's names, kings and queens. Thank you for coming on. John Brown, thank you so much. Bree, thank you for sharing your experience. Mytham, Projos, and the other one, I can't say that. Izzy, Mega Hips, Adir, Eloise, thank you for your questions. Who that Jesus is raised. Anybody? Ashley, T. Luang, I think I'm saying that. Femi. Oh, I got everybody. Rock Simmer, Gal for God. Everybody have a wonderful, wonderful day. Make sure that you stay tuned. Turn on your notifications. I'll post some of the pictures of some of the things. I'll look through my phone and find that one with the 2 teeth sticking out, because I'm sure everybody will love to see that. And anything else you want to see, just let me know. Have a wonderful, wonderful Tuesday. And for those of you in Europe, Wednesday, mercredi. I've been learning French a little. Mercredi. And have a great, great night. Bye.